First of all, it's important to understand how the body is supposed to function while you're sleeping. The body only wants to breathe through the nose. And you're not in control, so it's working automatically. It's doing what it does on its own. And it prefers to breathe only through the nose while you're asleep. That's true for all age groups. If your child is snoring, it is a concern, and I'll tell you why. The noise of snoring indicates that air is having trouble passing through the passages in your nose and throat. Why would that happen? It happens because the inside of the nose and throat loosens up and becomes narrower once the person falls asleep. And depending on their anatomy and the structure of the nose and throat, which they inherit from their family, that space may be too narrow for air to easily pass through. And secondly, which relates very much to a problem in children, is that their tonsils, which are these structures in the back of the throat, and adenoids, which are a similar structure in the back of the nose, are often enlarged in children. They're enlarged in children because children usually have a lot more infections with cold and congestion and allergies, as well as their body responding to all kinds of incoming particles. And these guards that stand at the entry point of the nose and throat, they enlarge in order to respond to these. This is a child's normal growing process. When these tonsils and adenoids grow too big for providing really any good benefit, now the problem is that it prevents a normal flow of air through the nose and throat. If you're not getting enough air through the nose and throat while you're asleep, your oxygen level drops, which wakes you up to take a breath. If you're waking up enough during the night and you really don't know that you are, it causes a lot of problems. It causes problems with development and growth. And even mild problems with these relate to learning issues and attention issues in children. So it becomes really important to identify if there is a problem with their breathing while they're sleeping. And snoring being so common in families, among people in general, it gets ignored, and just people don't pay attention to it because they feel it's just a normal part of sleeping. But it's not. That is why it's really important to identify the issue and talk to your doctor.